Comparison can feel useful because it gives the illusion of information. You might hear a story and think, now I know where I should be. But most of the time, people don't actually have the information they need. They have a date, a milestone, and maybe a dramatic detail. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. A woman had been feeling pretty good about her progress after knee replacement until she went to lunch with a friend. She was about 7 weeks out from surgery, using a cane when she left the house, still having swelling by late afternoon, and still working on stairs. Her friend, trying to be encouraging, said, "Oh, my neighbor had that surgery and she was walking all over town by 6 weeks." The woman smiled politely, but inside, the whole day changed. By the time she got home, she was no longer thinking about the fact that she could walk farther than she could 2 weeks earlier. She was thinking about a friend's neighbor whom she had never met. By the end of this episode, you'll have a clearer way to respond when comparison shows up, without letting someone else's knee replacement story become the standard for your own progress. Comparison is not a character flaw. It's one of the ways people try to orient themselves in uncertain territory. After surgery, there are so many questions without a single perfect answer. How much swelling is typical? When should walking feel smoother? How long should stairs feel awkward? When will my energy come back? When will my body feel familiar again? And when will my knee feel familiar? Your mind is often looking for a reference point. A friend's story, a Facebook post, or a neighbor's timeline can seem to offer a map when what a person really wants is reassurance and direction. The problem is that most comparison stories are not maps, they're snapshots, and snapshots leave out almost everything that would help someone understand the full picture. A knee replacement story usually gets compressed into 1 or 2 memorable details. I was driving in 2 weeks. I walked 3 miles at 6 weeks. I never had much pain. I was miserable for months. Those statements may be true or nearly true for the person saying them, but they omit details that would help someone interpret the story safely. They do not tell us what that person's strength was before surgery, how active they were before arthritis became severe, whether they had other medical conditions, how much support they had at home, what their surgeon recommended, what medications they could safely take, or what they were actually counting as success. Comparison can feel useful because it gives the illusion of information. You might hear a story and think, now I know where I should be. But most of the time, people don't actually have the information they need. They have a date, a milestone, and maybe a dramatic detail. What they do not have is the surgical context, health history, therapy plan, starting point, or goals. That's why one of the most useful questions after hearing someone else's story is, what information am I missing? It's a question that does not dismiss the other person's experience. It simply keeps the story from becoming a standard that it was never meant to be. There's another piece that many people might not be considering. People don't always remember pain, difficulty, or fear with perfect accuracy after time has passed. Pain memory research shows that the way people remember painful medical experience can be shaped by intensity, emotion, timing, and what happened near the end of the experience. That doesn't mean people are lying when they say I barely had pain or it was easy for me. And it also doesn't mean people are exaggerating when they describe their experience as extremely painful or difficult. Memory is human in both directions. Some people may recall the hardest moments more vividly, especially if those moments were intense, frightening, or emotionally charged, which can make the overall experience feel worse in hindsight. Others may remember the outcome more than the struggle. Months or years later, a person may genuinely remember either the broad ending or the most difficult parts more clearly than the full middle. That's one reason the person who says I had no pain may not be the best source for what your next few weeks should feel like. They may define pain differently. They may have had a different medication plan, a different tolerance, a different surgery experience, or a different support system. They may also have forgotten the parts that were hard because those parts are no longer part of their daily life. Their story may be honest and still not be useful as a benchmark. Unsolicited advice can make this even harder. I often tell patients not to take advice from someone they would not actually ask for advice. That might sound blunt, but it's practical. A friend's cousin, a neighbor from church, or a friend of a friend's sister's uncle who had a knee replacement in 1995 may mean well, but that person does not know your surgical details, your precautions, your medical history, your current symptoms, or your goals. If you would not ask that person to evaluate your x-rays, choose your exercises, clear you to drive, or help make a medical decision, be cautious about letting their story change how you view your own progress. When the question is medical, surgical, or rehab related, your surgeon, healthcare team, and physical therapist are the people with the context and experience to guide you. That doesn't mean every patient story is useless. Stories can help people feel less alone. They can give language to experiences that are hard to describe. They can remind someone that swelling, fatigue, awkward walking, or emotional ups and downs may happen during the process. The problem begins when the story turns into a rule. One person's timeline is not a standard of care. A 2025 longitudinal systematic review looked at physical function after total knee replacement over time. The authors found that self-reported function tends to improve in a clinically meaningful way by 3 to 6 months, while performance-based measures show more variable patterns. And that fits what many of us notice. Most people improve after surgery, but the pace and pattern are not identical for everyone. Some people feel better before strength or endurance fully return. Others do well in a clinic test, but still feel limited in the activities they care about most every day. That's why a single outside story rarely tells us all that much. A person may say, I was doing great at 3 months. But great compared to what? Walking around the house? Sleeping? Stairs? Golf? Pain? Work? Travel? Or getting through the grocery store? Without knowing what they mean, the comparison becomes kind of blurry. Two people can both be 3 months out and make reasonable progress while having very different goals. People also tend to compare upward. They compare themselves to the person who walked the farthest, drove the soonest, and had the least pain, or looked the smoothest on stairs. They rarely compare themselves to the person who had a slower or more complicated process. That selective comparison can make it seem as though everyone else is ahead, when in reality, their mind has latched on to the most threatening example. Online groups can magnify this because people who post frequently may be doing especially well, having an especially hard time, or feeling worried and looking for reassurance. Many people making steady, ordinary gains are not posting every few days to say they stood at the counter longer, walked a few more houses down the street, or had one better night of sleep. Usual progress is often less visible than dramatic progress or dramatic difficulty. Individual medical history also changes the picture. Research has found that people with diabetes, for example, may have different patient-reported and clinician-assessed outcomes before and after total knee arthroplasty compared to people without diabetes. That's not a rule, and more research is needed, so it should not discourage anyone. It simply reminds us that your knee does not exist separately from the rest of your body. Sleep, circulation, other joints, balance, strength, nerve health, and general conditioning can all influence how the process looks for you. Rehabilitation varies too. Expert consensus work on outpatient rehabilitation after total knee replacement emphasizes individualized decision-making because patients differ in presentation, goals, preferences, and progress. Some patients need more supervised therapy. Others transition a little earlier to a home program after receiving appropriate guidance. Large clinical data sets also show that care guidelines can improve outcomes while variation between patients still remains. Good care recognizes patterns without pretending every person should follow the exact same path. Driving's a good example of why advice from other people can be risky. Someone might say, I drove at 2 weeks, but that doesn't tell us whether it was the right or left knee they had surgery on, whether they were still taking medication that could affect alertness, whether their surgeon cleared them, whether they could brake safely, or whether their insurance or local rules created any additional concerns. Driving after knee replacement is not only a date, it's a safety decision that belongs with your surgical team and your specific situation. The same is true for walking without a cane. Someone may be proud they stopped using a cane quickly, but that doesn't tell us whether their walking was steady, whether they were safe outside, whether they were limping more without it, or whether their physical therapist recommended continued use in the community or not. An assistive device is not a failure, it's a tool. Used appropriately, it can help someone move more safely, while strength, balance, and endurance continue to improve. Walking is one of the first things people compare, and it is one of the reasons I wrote Walking Like Yourself Again after knee replacement, why walking feels awkward, and how people rebuild smooth, confident walking for everyday life, part of the Total Knee Success series. Many people see someone else walking smoothly and wonder why their own walking still feels uneven, stiff, tiring, or guarded. In the book, I talk through some common factors that may contribute to changes in walking after knee replacement, including swelling, fatigue, strength, gait habits, and the way walking can feel different from morning to evening. I'll leave a link in the show notes if you're interested. There's a difference between slower progress and symptoms that need attention. Worsening pain, sudden or severe swelling, calf pain or swelling, concerning warmth or redness, shortness of breath or chest pain, fever, drainage, or incision changes, or feeling unsafe walking are examples of symptoms that warrant prompt evaluation by your surgeon or healthcare team. Individual variation should not be used to ignore symptoms that may require medical care. A steadier benchmark is often internal rather than external, and clinicians usually want to know how a person is changing compared with their own earlier function. Walking farther than 2 weeks ago, swelling settling more predictably, getting out of a chair with better control, using stairs more safely, sleeping better, or participating in more daily activity with less disruption afterward may not sound dramatic, but those changes often say more than someone else's highlight story. If comparison shows up, it can help to bring the question back to context. What information is missing from the story I just heard? Is this person giving medical advice, or are they simply sharing an experience? Is this something I should ask my surgeon or physical therapist about? What has changed in my own function over the last couple of weeks? These questions slow the comparison down long enough to keep it from taking over the day. It may also help to have a simple response ready when advice comes in that you didn't ask for. Something like, "I'm glad that worked for them. I'm following the plan from my surgeon and physical therapist." That sentence doesn't argue, it doesn't invite debate, it simply places the decision back where it belongs, in your hands. Another option is, "That's interesting. My team is helping me decide what fits my situation." The goal is not to be rude. The goal is to protect the process from people who don't have the full picture. Before we close, I want to mention the Total Knee Success Insider newsletter. I share practical information tailored to where you are in your knee replacement process. If you're looking for clear, supportive education to have alongside the podcast, it's completely free, and you can click the link in the show notes to sign up. When someone shares a knee replacement story, it can be heard as one person's experience rather than a rule. Their story may be encouraging, it may be cautionary, it may be incomplete. What it cannot do is tell you whether your own progress is appropriate, because that requires your medical history, your surgery, your symptoms, your goals, your therapy plan, your support system, and your healthcare team's guidance. In the next episode, we're going to move from comparison to the milestones that actually deserve attention after knee replacement. We'll talk about walking, stairs, sleep, independence, daily activity, and why functional progress often gives a more useful picture than an arbitrary date. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.